It's Tina Grassi. I am here in Medellín to get stem cell therapy for my hips, my spine, and my recently broken wrist. I had no idea what to expect coming in on the medical center because, again, it's Medellín, it's a third world country. I have never been here before, but I trusted it just from everything that I had experienced so far with the people. And it was great. Reju, the clinic itself was modern. It was extremely clean. It was like being in an American spa, like no different than any American clinic I've ever been to, including the whole building, because I had to go to multiple floors in different places, the operating room. Dr. Mia, who I had no idea also, again, what to expect, was amazing. She was completely bilingual. She was friendly. She came out to ask questions, make sure I felt safe and comfortable before any of the treatments, and then after, again, to check on me. The treatments I received were exosomes that they started with, just to help my body get ready, as well as an oxygen therapy and a Myers cocktail, which is a vitamin mix, just to make sure that my body was fully prepared for everything that I was about to receive. And then then I had the stem cell treatments done in 2 days with a day in between to give me some recovery time, because the areas that I was receiving it in were extremely inflamed and problematic. And so just to make sure that I had some time to rest and some time to recuperate instead of just being kind of slammed with treatments. And then it ended again with the final exosome treatment, just to top everything off and make sure everything's going to settle in. After the first treatment with the hips, I was in a lot of pain. That's my biggest trouble area. 4 years I've had chronic pain every single day of my life there. So I'm not terribly surprised, but I was not shocked at all because I was given very good warning about all of the different array of outcomes that might come from immediate relief to nothing to pain for up to at least a week. So I was not surprised, and luckily, again, they were extremely responsive. So it was about 24 hours of pretty intense pain, not gonna lie, but I could feel, I'm pretty in touch with my body because of everything I've been experiencing, so I could feel in the hips. I was trying to describe it like this army of soldiers that I just unleashed in my body that was going and taking over all of the inflamed cells. I call it cellular warfare in my body. And I just imagined it like that in my brain in order to be with it and know, mentally, that this is what was supposed to be happening and that this was going to be better for me in the long run, as I experienced pain again every day, so it wasn't anything that I couldn't handle. And then the next morning, I asked them if there was anything I could take, and they recommended some over-the-counter medication that I could take to at least ease it. But by the second day, it went back to normal. So I actually feel today, which is now 4 days later, less pain than I came in here with. But it's not a miracle yet. But again, it's only been 3 days. So I am extremely hopeful that starting, my guess is about up to the third week, that it'll start to get better. And I'm willing to wait up to the 3 months, which is, I was also told that it could take that long. And my wrist, so I got the hips done first, and then 2 days later, I went in for my spine and my wrist. My wrist was broken 2 weeks ago, so I was able to get in here as quickly as possible. And Dr. Mia said that she was able to put the shot right into the cracked bone. And that was Friday morning. And Friday and Saturday night, by Saturday night especially, I could feel my hand twitching. And it would hurt briefly just because it was twitching on a cracked bone. But then it would go back, and I could literally feel the bone putting itself back together. I could feel like my hand would start shaking and vibrating. Not painful at all. I could just feel the vibration of it. You could almost tell that the bone was putting itself back together, which was a really cool feeling. And it happened for about 3 hours sporadically, probably about every 30 minutes or so. Okay, so I was definitely a little bit nervous coming to Medellín by myself. I am a single woman with an injury, and I've never been here before, and I have very limited grasp on the language. But before I even got here, I felt so comfortable because of the experience that I had with Eric and with Richie, talking to them. I knew from the very beginning that they were going to take care of me at every point. They let me know that I was going to get picked up by the airport. They sent me pictures of who would be picking me up and introductions. I was given recommendations on where to stay, that I would be safe. So I knew that wherever I went would be great. They gave me which apps to download. They gave me insights into everything, and they told me I would be picked up each time from wherever I was staying and taken to the clinic directly and taken back home. And they checked in on me multiple times a day, every single day. So there was never a moment that I felt anything but completely safe, completely comfortable. And probably also very importantly is anytime I reached out with any questions, there was an immediate response, which to me is extremely important coming here in the manner in which I did. My impression of Medellín is that it was hyped up just a little bit too much. I came in here, I was a little bit comfortable coming here, but then people were trying to scare me, telling me about kidnappings and cartels. And I came here and I even walked around a little bit by myself, not at night because I'm not going to be stupid or test anything. But everybody was very polite. Nobody even came anywhere near me. And I love the city and want to come back when I actually have more time to explore it. So I am leaving tomorrow, and I am extremely optimistic that this is going to be the thing that's finally going to work out. As I said, again, it's been 4 years of this, and I don't know what it is, maybe just all the work or the feelings that I have in my body, but I'm extremely optimistic that within the 6 months frame that I was given, that this is going to be the thing that finally gets this baby to go away.